Hey guys, I'm Dr. Mika Riley. A common question we get is how soon I should start rehab after ACL surgery. This is quite dependent on the extent of the surgery, like what was repaired and other factors. Most surgeons' protocols suggest beginning PT 1 to 2 weeks after surgery. The reason they want you to wait is to respect healing, protect the graft, and make sure you're not being pushed too much too soon. However, they still give you a home exercise program or a sheet of exercises to do at home on your own. This is where often I see people have a hard time understanding the exercise themselves, along with how hard to push or how many to do. Because of this uncertainty, I strongly recommend my patients begin PT with me 3 to 5 days after surgery to get started with this program. The early stage of rehab sets a foundation moving forward, and doing too much or too little early on can really slow down the process moving forward. Working with a PT who has tons of experience with early ACL rehab will clear things up and make sure you are setting yourself up for success. The rest of this video will be about what day 1 of ACL rehab looks like, and I'll break this down into respecting graft healing, quieting down the knee by managing pain, and starting basic range of motion work. Respecting graft healing. It is crucial to respect the graft healing in the early phases of rehab. You have just recently gone through a major surgery, and we must consider what tissues were just freshly repaired. Following an ACL reconstruction, this will mean the graft, but also the meniscus is often repaired as well. It is crucial that you follow your surgeon's protocol because they are the ones who have the deepest understanding of what all was repaired. Your PT will help you to ensure you are following these guidelines while still moving the needle forward and creating the foundation. Early on, your graft or your new ACL undergoes some significant remodeling and settling. This new ACL is still very immature and cannot handle significant loads. With an ACL reconstruction without a meniscus or other repaired structures, there are no weight-bearing or range of motion precautions, but your PT will help guide you back, walking and getting you around the house while factoring in your ACL healing. When someone uses their own tendon, this tendon they've used must remodel for it to tolerate the load that you're wanting to put it under. If no other structures were repaired in addition to the ACL, an individual might be able to stress the joint a bit more than, say, someone who has had a meniscus repair in addition to an ACL reconstruction. If another structure was repaired in addition to the ACL, such as the meniscus, then we need to protect both the ACL remodeling and avoid disrupting the healing of the meniscus. The meniscus is a load-bearing structure, so it helps distribute force through the knee. When it has been repaired, you won't be able to bear weight immediately and won't be able to bend the knee past a certain point to protect the repair. We need to promote an optimal environment to ensure that your knee and your body are ready to progress. Considering your knee has gone through significant trauma, we need to make sure that your knee is not being pushed too much too soon so we can help your knee achieve an optimal environment sooner. I see many people who push their knee too much too soon because they are eager to be functioning normally as soon as possible, and causes their knee to go in the opposite direction and results in increased swelling and healing timeline. It is important to find the appropriate amount of load that your knee can handle so we don't irritate the tissues further and protect the healing and integrations of all structures involved. Quieting the knee down. Quieting the knee down refers to reducing swelling and pain. Your knee goes through quite a bit of trauma during surgery, so it is very likely that you will be experiencing pain, swelling, and bruising. Our goal is to find the appropriate amount of load your knee can handle to avoid an increase in swelling and pain, all while trying to reduce it. Many staples to reduce swelling and pain include prescribed medications from your surgeon, continuous icing, elevating the leg, and using crutches to help offload the knee. Pain and swelling cause the knee to become more inhibited and atrophied and can be a nasty cycle if not managed appropriately. Many clients I've seen want to get rid of the crutches as soon as possible or negate the importance of managing pain and swelling. Think of it this way: the longer you avoid properly managing pain and swelling, the longer it will take to progress well through your ACL rehab journey. Beginning range of motion. The basics in ACL rehab are non-negotiable. In order for your knee to settle down and be able to tolerate higher levels of loading down the line, restoring range of motion is crucial, and that begins right after surgery, not 2 weeks after surgery. I see too many people come in to see me after waiting the 2 weeks their surgeon recommended, who have been unclear about the range of motion exercises that have been given to them by their surgeon, or are unsure of how hard to push them, so they either don't do them or don't do them hard enough. And when they finally come in after 2 weeks of doing no effective range of motion exercises, they are super stiff, and regaining range of motion is a much more difficult and painful process. Normalizing Emphasizing knee extension, so straightening of the knee, as soon as possible should be a top priority, and because it is pretty tender after surgery, people are often too shy to work into it on their own. Functioning without full knee extension can cause problems in your ACL journey if not normalized as soon as possible and maintained during the whole process. Research has shown that if terminal knee extension is not achieved, it can lead to worse outcomes, increases the risk for osteoarthritis, causes abnormal gait, increases load on the patellar tendon, and limits the ability of the quad and other muscles to produce optimal force and function. Getting range of motion back after surgery is tough, and waiting longer because you are unsure of what to be doing only makes the process even harder and more uncomfortable. So instead, I recommend people start with me earlier rather than waiting around and trying to figure it out themselves. Every ACL surgery and recovery is different, but certain things must be factored in throughout the process. Early on, the main focus should be on nailing the basics to create a good foundation by emphasizing protecting the graft, quieting down the knee, and beginning to address range of motion. The sooner that someone starts addressing these issues properly, the smoother the process will be. I don't like that patients are left to figure it out on their own when they could be working with an expert who has seen so many ACL patients early in rehab. So my recommendation after ACL surgery is to stop guessing what you should be doing and start with your PT early. If you have had surgery, check out our video in the description showing you some of our favorite post-op exercises.